Good afternoon, everyone, and welcome to our webinar. I'm Donna Rice, the Chief Operations Officer for Diabetes Sisters, and thank you for taking the time to join this important conversation. At Diabetes Sisters, our webinars are designed to really inform, empower, and really provide critical insights into diabetes care and management. So today, we'll be diving into an essential topic, type 1 diabetes screening, a crucial step in identifying and delaying the onset of type 1 diabetes. Before we begin, I really want to extend a special thank you to our sponsor, Sanofi, whose generous support has made this type 1 diabetes screening series possible. We're incredibly grateful for their commitment to advancing diabetes education and awareness. We're honored today to really have an exceptional panel of experts and advocates with us today. Not only will we explore why screening matters, but we're going to also take a closer look at the emotional journey that comes with the process. Our panelists bring a unique combination of clinical expertise and personal experience, offering invaluable perspectives on making informed healthcare decisions. So it's my pleasure to introduce our esteemed panelists. Our one panelist, Dr. Victoria Buhari, who hasn't joined us as of yet, is a board certified in endocrinology, diabetes, and metabolism, as well as lifestyle and obesity medicine. She's the founder and CEO of Perry's Wellness and Diabetes Center in Charlotte, North Carolina, and an active advocate for diabetes care and health equity, and a member of the Diabetes Sisters Board of Directors. Chelsea Lagone is a family nurse practitioner and certified diabetes care and education specialist with over a decade of experience in adult and pediatric endocrinology. Chelsea is a passionate advocate for type 1 diabetes screening, drawing from her own experience as someone living with type 1 diabetes and as a parent who has navigated the screening process with her children. Jamie Klein is a registered nurse and certified diabetes care and education specialist with a deep commitment to leveraging education and technology to improve diabetes care. Having lived with type 1 diabetes since 1988, Jamie recently chose to screen her own children and understands firsthand that importance of informed decision-making. We're grateful to have these incredible experts share their insights, experience, and expertise with us today. Remember, if you have questions, add your questions to the Q&A, and our panel will answer these questions after the discussion. So please join me in a warm welcome to our panelists. And I see Dr. Buhari has not been able to join yet. So we're going to open up the questions to both Chelsea and Jamie. So the first question is, what motivated you to consider screening with your children and other family members with type 1 diabetes? And why don't we start with you, Jamie?
Yeah, so I have worked in my career as a nurse, started in diabetes and pediatric endocrinology, and we were actually doing TrialNet. It was many, many years ago, back in 2000, probably 8, I would say, is when I started learning about screening for type 1 diabetes. I wasn't a mom at that point, but I was really passionate about it for the families of those. I became a mom in 2009 and again in 2012. And honestly, when it came time for me to screen my children, I got nervous. I was concerned, like, what would I do with the information? At that time, there was not anything to do except for have the knowledge that they did have antibodies for type 1 diabetes. So I did not choose to do it at that time. And I honestly didn't choose to do it until this past November, when my kids are now 12 and 15. And finally, we had a conversation and decided together that it was the right thing for our family to do, to have that knowledge.
Very good. And Chelsea?
So just to start with saying that this is just Jamie's and my personal experiences that we're sharing. But my situation was, I live with type 1. I was diagnosed at age 23. First person in my family to have the diagnosis of type 1 diabetes. And when I was pregnant with my first child, I went through genetic counseling because I was concerned about my daughter developing diabetes. Unfortunately, at that time in 2009, I was provided with not correct information about her risks being much lower than what they truly are, and was caught off guard when at age 3, she was diagnosed with type 1 diabetes. So When she was diagnosed, I was very concerned because at that point I'd had a second child and was very worried about him also developing type 1 diabetes. So when I learned about screening, I thought, you know what, I'm going to actually go for it and see what his risks are, especially now that I have it, his sister has it. So when my son Ryan was 3 years old, we did trial net screening. And we were told that he did have 3 of the 5 type 1 antibodies. And they said by within 5 years, he would be on insulin. And at age 3, it's really challenging because there aren't a ton of clinical trials that you can do at such a young age. But the thing that was really nice was that we were given opportunities if we wanted to participate in clinical trials, and he did. So at age 3, he participated in an oral insulin trial. And then when he was 7, he participated in another clinical trial. But just as they said would happen, 5 years in, he started insulin. And unfortunately, he was not old enough for Tzield because you have to be 8. He was only 7.
Very good. So looking at this, was there like a specific moment or reason that really prompted you to take steps? Because some of the feedback that we've been receiving from some of our members is that, number one, there's a lot of fear around knowing it. So what was that kind of big moment? And I know you both lived with type 1 diabetes, and you both have a professional background as well, but thinking in terms of just coming from that mom perspective, what was the biggest thing that really said, yes, this has to be done?
I'll start with so our role at Dexcom, and again, we're not working for or speaking on behalf of them today, but I go to a lot of conferences, and I actually met someone who was working on the Tzield right when it was being launched, and we talked for a long time about knowing and what to do with that information and how important that is. And that really started me thinking again about screening because that's time I was kind of like, I'm okay not knowing. I know the symptoms. I look out for them. If there's any, I check with a meter for the kids to see what's going on, and I would get them treated promptly if I needed to. And so um, Chris and I saw each other several times over the next 2 years, and each time we had a different conversation about the screening process and what the knowledge is and what's happening with Tzield and why it might be important for me to know that information for my children. At 12 and 15, I think my children needed to be a part of the conversation. And so after coming home one of the times and chatting at a conference, I said to them, here's some information. We really could have the knowledge to prepare if one of you or both of you were to come back positive with the antibodies. We could really understand what our options are, what we can do. And I feel like it's an important thing. Are you guys on board? And they both said, if you think it's the right thing to do, then we're on board. Now, granted, my younger son was very hesitant about blood draws. He does not like them. So I ordered one of the at-home kits in order to do that. It sat at home for 6 months. I was at another conference. Chris and I talked again. I came home and I ordered the Ask kit from Barbara Davis Center. And we went and got the blood draw, and we are able to have that. So it really, for me, was a building on of the information that I was learning that then got me to the point where I was like, okay, I can do this. And most of my hesitation came from I was going to feel really guilty, honestly, if my children had the antibodies for diabetes. And Chelsea and I had this conversation at one point as well. And I was like, I don't know what I would do with that information. And I honestly was scared to have to deal with those emotions and that information. But I did decide to write myself this little letter. I don't know if you can see it, but it says, Jamie, open if one of the boys is positive with type 1 diabetes antibodies. And I just wrote in here that you don't blame your parents for your diagnosis. You never have and you never will. And your boys aren't going to blame you. It's not your fault. So I have this to remind myself because I know I was going to feel guilty if that happened. But so that was really where the crux of it came. And in November, as soon as I got those kits, I took them that week to get the test. So as soon as I decided, we were all in and we made it happen.
Very good. And Chelsea, any comments?
Me, I like to be in the know, particularly as diabetes options advance. When I think about just in the time that I've had diabetes and how quickly things change, what if they really do advance even more? There's more options for delay or maybe even cure in the future. I want to know. So I have two other children who are 3, well, 4 now and 1, and I'm going to continue to screen for them because if that day comes when they're like, hey, this is available, if you have antibodies, I'm going to know if at that point versus having to wait, get the screening, wait for the antibodies. I want to be in the know. Plus, for me, I already do a lot of checks here and there. I'm someone, and I think a lot of us who live with type 1 and have children, as soon as you notice that they're reaching more for the sippy cup, or maybe that diaper seems more full than normal, yes, I'm grabbing that glucometer and I'm doing a finger stick anyway. So I just feel like if I knew, I would just kind of know. And to me, knowing for me personally is just more beneficial than not knowing. And just that one day, clinically, with my background, I've helped a lot of families throughout the years who are impacted by T1D. And, when you have that second family member who is diagnosed, and to Jamie's point, yes, we know the symptoms, but symptoms often come super late, where we're still seeing admissions to the hospital for diabetic ketoacidosis and DKA, and how dangerous that is. So if we're aware earlier and I'm able to prevent, that escalation of severe illness, and risk, then to me, that's also another benefit.
Very good.
Chelsea, I just want to echo on that. That was one of the reasons that prompted me is if we could start something early, if they were positive, and help them get on treatment sooner and prevent that DKA episode. I think that's the huge thing because as anyone that's worked with newly diagnosed people with type 1 diabetes, it's a hard learning curve. Even when you know diabetes, it can be really hard if you enter the diabetes diagnosis in DKA versus having some time to really kind of get used to the idea and start treatment early.
Great points, great points. And I'd like to turn it over now to Dr. Buhari to really kind of give her overview.
Yeah, sure. And I know we're a little bit behind here, so I'll just talk, right? We'll just go
Very
ahead
good.
and we'll have a conversation here. So I think it's profound where we are now, right? So, traditionally, type 1 diabetes was diagnosed when clinical signs appeared. And what we do know is that 30 to 40% of people were diagnosed when they're in DKA, diabetic ketoacidosis, which is a life-threatening condition. But what we know now is that those antibodies that you have been mentioning, right, those autoantibodies, which is antibodies that actually attack the pancreas and decreases the amount of insulin that we're producing, they occur months to years before the clinical signs appear. So it's wonderful that now we can actually detect type 1 diabetes before the clinical signs appear. So there's stages of diabetes now, stage 1 to 3, where stage 3 was what we're used to. The clinical signs are there, you have high blood sugars, but stage 1 and 2 now exist. And stage 1 is when, again, antibodies exist. As long as you have 2 antibodies, you have the diagnosis of type 1 diabetes. But in stage 1, blood sugars are normal and there are no clinical signs. And then stage 2, blood sugars are mildly elevated, not to the point of the diagnosis of diabetes, but mildly elevated. Again, no clinical signs. So with screening now, we can actually detect people in stage 1 and stage 2. And that's wonderful, right? It's profound. What we've seen is that people that are detected early, stage 1, stage 2, and they're monitored in some type of monitoring program, that risk of diabetic ketoacidosis goes down from 40% all the way down to less than 5%. And that's huge, right? And actually getting screened and being able to identify the diagnosis of type 1 diabetes early gives you time, right? Time to educate yourself about the diagnosis and really time to digest exactly what this diagnosis is and the shock. Whilst type 1 diabetes is a condition that has a genetic background, what we do know that's most people actually don't have a family history of type 1. So you can imagine you're in the hospital, new diagnosis, unexpected, and everything all at once. But if you get screened, you have time to educate yourself, update yourself with the new technology. And then with the monitoring program, decrease that risk of diabetic ketoacidosis. So I really think it's a huge advancement when it comes to where we've reached now to give family and loved ones the opportunity to be able to get screened.
Good. Thank you, Dr. Buhari. And we do have some questions coming in, so I'm going to go ahead and address the questions so that our viewers, those questions are answered and also provides more, information. So one question is, how accurate are type 1 diabetes screening tests? Like the at-home test, I'm assuming.
Yeah, very good question. Whenever there's a screening test, what we look at when healthcare professionals is called specificity and sensitivity. And essentially what that means is how many false or how many true positives or how many true negatives actually exist. What we do know that's like this, the specificity and sensitivity is really more than 95% for both. That means that we're really not if somebody's truly positive, then there's a high chance that you are actually positive. So it's very accurate.
Very good. And then a follow-up question is, where can one get screened?
Yeah, another excellent question. So there are various places and choices that are available for screening. We talked a little about the ASK program. So the ASK program is one that screens the general population. So there you can do a home test kit where you can go online, register. They will mail you the test kit. You do the finger stick and mail it back. And then you have TrialNet is another place where you can get screening. With TrialNet, you do need to have a family history of type 1 diabetes. And again, this can be done in person at a laboratory, or it can be done with a home test kit. Your healthcare provider can also order the test for you to get it done at a nearby lab. We do know LabCorp. You can go to LabCorp, Quest, and Mayo laboratories. You can get it done there too. And what I'm saying is not really an exhaustive list. There are many options out there, but these are some of the places that you can get screened. And again, what the screening will involve is checking those autoantibodies, checking the antibodies. And there are 4 that we look for. The insulin antibody, the GAD65 antibody, the islet antigen 2 antibody, and then the zinc transporter. So again, multiple options for you, ASK program, TrialNet, and of course your primary care doctor.
Right. So much information to take in and to know. So another question coming here. And I think, Jamie, you kind of alluded to this a little bit, both of you did, but how do you prepare yourself and your family, both practically and emotionally? And I think first it starts with you, but the whole screening process seems a little bit complicated. So could you just shed some light on kind of that aspect?
I will agree that it felt a little complicated in the beginning. And being a nurse and someone that knows a lot about the screening process for different things and going to the lab is a no big deal after diabetes for all this time. It was really figuring out what I wanted to know. The reason I went with the ASK program is because they sent me a kit that I then took to a lab to have a blood draw. So we actually went with the blood draw because when I had the kit at home, it's a finger poke, and you can do it that way, which I thought was going to be the better way because my son was not really wanting the blood draw. But you have to do it on a Monday, Tuesday, and a Wednesday. So honestly, by Wednesday, I'm like, shoot, another week went by and I didn't do the kit because now we're past the time. So when I had the appointment for the blood draw, we went. Once I prepared myself and I was ready to do this and I was ready to handle any information that we were to get from this screening, it was really about choosing the way I wanted to screen them. And those programs have people to help you through that process. There's people to call and ask questions if you have questions, and they really do help you once you're ready to do it. So I would say prepare yourself first for being ready and being ready to take those steps before you request the kit. Then if you have any questions, once you do that, we are part of the trial with the ASK program. And so there was a consent to sign and I spoke to someone and we reviewed the consent. Then I just told my kids it's just like when you've gone and gotten a blood draw before. Then we're going to have a waiting period where we're going to wait and see what the results are when we get the results in an envelope, and we will sit down together and open it and deal with whatever it is that is in front of us. So that's how I prepared our family.
Kelsey?
So both of my boys who've been screened are little. So Ryan was 3 when he started, and Leith was 2 when we started screening. So given their little ages, they didn't have much say. Obviously, that was more my choice, but understanding that lab draws are a lot. I took Ryan, well, especially both of them, to labs that I knew were good with peds, especially littles, because that can be challenging. So that's very important. So I would, if you have little kids, I would certainly reach out to your other friends who have little kids and find out what labs do good draws, if you're going to do a lab draw. And then I'm a big believer in rewards. So when they're little like that, we used to give Ryan a Matchbox car every time he got his labs, because being a part of a clinical trial as well, he had a lot of draws, and he's a champ now. He doesn't, he looks right at it. He doesn't care, but certainly that part was challenging. We screened Ryan through TrialNet, and this was back in 2015. So their process has changed a little bit from that time frame. But I did like the fact that TrialNet was so streamlined. They know their stuff. There was, to Jamie's point, support like Ask provides. So I had someone I could actually ask questions to who knew what they were talking about. Versus when I screened last year with my son Laith, we went through his primary care provider. I knew what needed to be ordered. There are resources out there that you can take to your pediatrician or your family provider and say, can we please order these? So they went off the sheet that I provided, ordered everything appropriately. But then when I went to the lab, there was some confusion from the lab standpoint. So I think, just to Dr. Buhari's point, is making sure that you have a lab that also understands the proper things to process when it comes to ordering, because for my son, we had to go twice, which was not a great experience. So I think sticking with the labs that are recommended is probably also beneficial.
Very good. And another interesting question, and it says, how did you handle the conversations with other family members? So not only do you have your immediate family, but you have family members, and we know there's can be challenges there as well. Yeah.
I honestly only spoke with my husband, and when we were in the process of having our wedding, and I said, "Hey, like we have kids, like what if they have diabetes?" And he's like, "Well, clearly you aren't the reason that you don't want them to have it, and we'll deal with it just like you deal with it." And so that's kind of his attitude towards the screening as well, was we'll take it how it is, and we'll deal with whatever is presented to us. And so him and I spoke about it, and we actually didn't tell anybody else because I didn't want to have constant questions during the 4 to 6 week waiting process. So once we got the results, and both of my boys were negative, then we shared that information with extended family, and I shared it in a way that we did this for our kids. If you are a first degree relative of me, then it might be a good idea for you to get screened as well, because you have a higher chance than people who are not a first degree relative of someone with type 1 diabetes. I don't know that anyone's taken up that information and that are adults, meaning my siblings, but I definitely think it was important to share that we did go through the process. And now I have a story to share with people should anyone go through that process. And we have a few friends who have children with type 1 that some have screened their other children and some haven't. So it's been an interesting conversation.
Yeah. Chelsea, any comments?
I'm a huge believer in choice, like just, you make the best choice for you and your family. But with that said, I'm a big believer in informed choice. So I think it's really important that awareness is brought to family, to anyone that, could potentially have a higher risk. From the time I was diagnosed, I would love to see, I think we all agree that more overall awareness around type 1 diabetes around the world and our country would be tremendously valuable, so symptoms don't get missed and people are diagnosed earlier regardless. But I think more needs to be done about screening, even broadening the idea of screening for autoimmune diseases in general. Working in clinic and you meet the family and it's like, is there, someone new diagnosed with type 1 and you're like, is there any other T1D in the family? And they're like, no, but my mom has rheumatoid arthritis or aunt has Hashimoto's thyroid. Like there's a lot of connections with autoimmune conditions and it's not always T1D. And I think that that's a piece that is missed. I've been very impressed with some clinicians as my son was just at a pediatric gastroenterologist and he was there for celiac and he approached me about T1D screening and he said he's recommending all of his patients with celiac be screened for T1D. And I just thought, wow, that's remarkable. And I hope that we get to the point that that's more broadly encouraged and, maybe required. That would be incredible if we caught so many people earlier.
Yeah.
Chelsea, I couldn't agree more. I'm sorry, Donna. I was just going to say, I think, it was never brought up at our pediatrician, and I love our pediatrician's office. I'm not saying anything against them, but I think there's so much to know and so much that they look at. So I'm going to use these results when we go in for their exams, just to bring up the awareness of it. And I think that can be the role of anyone who does this, is really helping get the awareness that this is out there and it is available for people, just like Chelsea said. So knowledge is power. And once I got over the emotional side of it and went with my logical side that I generally lead with when it comes to healthcare, then that was a huge, huge important step for me. And I think it's really important for us then to go out and educate others.
Yeah, I'm going to add to that also. So, there's some excellent points. In addition to all of that, there's actually intervention that can be done if you are, in stage 2, for example, where we now have a medication, teplizumab, that came out November 2022, that delays the onset of stage 3 type 1 diabetes, and also the opportunity to be involved in different clinical trials. So not only are you educating yourself, but the opportunity to actually do something that might make a difference is also there, which is very important.
And this is a great segue into another question that just came in. If somebody tests positive for T1D antibodies, what is the benefit of the drug versus strict monitoring and lifestyle?
Yeah, so I can go ahead and take that. So teplizumab, or Tizo, that was FDA approved last year, did show that it prolongs the onset of clinical stage 3 type 1 diabetes. So what that means is that the signs wouldn't show for many years, and also you have a delay in that progression, right? So again, gives you more time and also prevents the risk of complications. So there are many benefits in terms of taking the medication. Of course, with me being lifestyle medicine certified, I'll never throw lifestyle away, right? That is always the foundation of anything when it comes to chronic disease. So the lifestyle piece always falls in. But definitely there is a benefit in terms of even if you're in stage 2, right now FDA approved for those who are age 8 and above in taking the medication.
I'm thinking about it, it's really a new era. We have a new drug, right? So this is very new for T1D. So I think there is this whole learning curve and the need for education, both for individuals, the general population, and also for healthcare providers. So really just looking at kind of like the needs out there, and kind of, at Diabetes Sisters, we're really trying to kind of like really answer some of the questions that are out there. And I think that, all of your commentary today has been like so important for our members. So I know we're running short on time, and I just want to throw out one question. So, just maybe some closing remarks, like really, like what advice would you have, for like some of our women, our members, or people out there that are really struggling with the decision to screen their children? Some maybe one tidbit or advice that you could each give, and then we'll go ahead and close up our meeting.
Sure, I can start. I think Chelsea nailed it with choice is important. So you do have a choice. This is not a mandate that you do it. And so I think it really weighing out the options of knowing and not knowing. If you know the information, what will you do with that information? Is that information that you're going to look into, like you have some positive antibodies and you can look into TZIELD? Is that something that you want to know? So once I came to the realization that I wanted to know whether they had autoantibodies or not, I also looked into the medication. So I could, in that waiting period, I looked into what would that involve, what would the process be, what would that benefit? And I decided that any time that my children could delay experiencing living with type 1 diabetes would be worth it, in my opinion, based on all the reading and everything that I researched when it came to that. Because as anyone living with type 1 knows, it's a daily disease. It's something that you're managing all the time and it's doable. Chelsea and I can tell you from experience, it's 100% doable. We don't let it stop us from doing anything in our lives, but it's something extra to deal with. And if I could delay that for my children, I was definitely wanting to do that. So I would say really take a look. And if it's the guilt factor, counseling could be a good option to go through it. I did a couple sessions with that, just talking through like, why was I feeling so guilty? And that's when I ended up writing the letter about it. So I think there's definitely options. And if you're a no today, it doesn't mean you won't be a yes later on. So just keep thinking about it and learning more as more and more information comes out.
And I love that message you gave. It's not my fault. I thought that was kind of a beautiful way to kind of like express those feelings and those emotions. That's great. Chelsea, any last minute?
Yeah, Jamie, I love everything you just said. I agree. I think I would ask somebody, what is your hesitation? Like really identify your why not. And then, that risk benefit piece of it, writing to Jamie's point can be tremendously helpful. Reaching out for support for people who've been in the boat, I think is also great. Sometimes it can be very isolating in this space, because it's like, especially if you're scared, sometimes being really honest with ourselves about what this could mean for the person that we love, what this could mean for ourselves, but also what if positive, then to what everyone's already said, it's like there's options depending on age, of course, but I think most of us who live with T1D, and certainly for my children, I would say what I wouldn't give to take one day of type 1 away, so that they didn't have to, stop their sport or, go through the school day without having to go to the nurse, right? Like just to give them a day, let alone potentially many days of delay. To me personally, that's why we did clinical trials, because I wanted to do anything we could to just delay any day that we could.
Very good, very good. And Dr. Buhari, your comments, thinking in terms of too from like a healthcare perspective.
Yeah, and I'll say, both aspects. For someone that's thinking about screening, knowledge is power. And Chelsea and Jamie brought up some excellent points, which I wouldn't reiterate. But knowledge is power. I'll leave it there, but gives you the opportunity to educate yourself and involve yourself in these clinical trials, etc. For the healthcare providers, again, knowing that now there's opportunity to catch type 1 diabetes earlier. And last year, there's actually a consensus guidance that has come out for those that have tested positive that gives healthcare providers some recommendations when it comes to monitoring. So there's a lot of information out there for the healthcare providers too. If somebody were to come, Jamie were to come and say, this is the results I have, where do I go? There's some guidance that's out there too. The Ask program also has some guidance. So really, again, I'm going to summarize it by saying knowledge is power. The more we know, the more we can equip ourselves to make better decisions.
Wonderful, Rafa. So looking at the time, I'm going to just provide some closing remarks. And I really want to extend my deepest gratitude to our incredible panelists, Dr. Buhari, Chelsea Lagoni, and Jamie Klein. It's been great. Your insights into the screening and your personal expertise, your professional expertise, I think really gave a great comprehensive overview to our viewers today. So I really, really appreciate your time and dedication. I also want to take a moment to really thank Sanofi, our sponsor, for their generous contribution. And we know that we have a long way to go, really educating both the public and also healthcare providers. And we really thank you for that. So at Diabetes Sisters, our goal is to really keep our members informed. So if you're looking for any additional resources, we have an entire page on our website dedicated to T1D screening. Dr. Buhari has authored like 3 comprehensive articles and also a series of videos, step-by-step videos on why screen, the how to get screened, and then what those results mean. There's 3 separate videos that are concise, to the point, and very comprehensive. And you could find those on our website to really help you as you're going through this decision as to screen or not to screen. So remember, all the videos are on our website and they are on demand for your viewing convenience. We also have our panel coming back, Jamie, Dr. Buhari, and Chelsea, on February 17th and 18th. We'll be doing some type 1 diabetes screening workshops. These are interactive workshops. They're like our meetups, so that you could come in, there'll be smaller groups, and you'll have the opportunity to ask candid questions, share your concerns, share anything about kind of what you're feeling about type 1 screening, and then we'll be able to provide some direction and resources as well. So February 17th, it's at 12 noon. February 18th, it's at 7 p.m. You do need to sign up on our website. These workshops will also be repeated in March and April. This is a series, a 3-month series dedicated to type 1 diabetes screening. So stay tuned for more. Also, other events on February 25th at 7 p.m., we're going to be launching a pre-diabetes and at-risk workshop. And we felt really that it's really important that as a diabetes platform that we really need to really be focusing on the pre-diabetes and the at-risk as well. It'll be led by Robin Nwanko, who's a researcher in diabetes prevention. It'll be a monthly series, and it's perfect for anyone who's at risk or anybody with the diagnosis of pre-diabetes. So if you know somebody or you have a loved one that's at risk, please have them join. And then on March 4th, we're going to be breaking down the 2025 diabetes care standards. And so we're going to take a deep dive into the latest updates and diabetes care guidelines. And what does that mean for you as a person living with diabetes? So please join us. So to everybody who's joined today, a big thank you for your time, your engagement, and your dedication to learning more about this critical topic. A big thank you again to our panelists, and a special thank you to Sanofi for their unwavering support for the Diabetes Sisters mission. So we look forward to seeing you at our upcoming events. In the meantime, stay informed, stay empowered, and take care and have a wonderful day. Thank you, everyone, for joining us. Bye-bye.